Hi, I'm Terry Gardiner, the National Policy Director with Small Business Majority, and I'm happy to be here today because I'm flying west from Washington and where I currently live, and I'm from Alaska, so I feel like I'm halfway home, and I realize that's why I feel so good. Small Business Majority is an advocacy group, and we advocate for the general interests of all small businesses. And obviously, healthcare is and has been a big problem for many years for business owners. I myself started my career when I was very young in Alaska as a commercial fisherman, which is sort of a seagoing version of a lot of people you have here in Iowa, the family farmers. It's a very small business. You're all self-employed, you have investments, but you're basically on your own. And we have a lot of self-employed in our country. I later started a seafood processing business, which I owned and operated with some friends of mine for 23 years. So my real expertise in healthcare is paying for healthcare premiums. As the previous speaker pointed out, employers on average pay about 75% of the total cost of health care. There's a lot of variance between employers, so as an employer you spend a lot of time trying to figure out how to cope with all the health care inflation. Small businesses, it's a very flat pyramid out there. At the bottom of the pyramid we have 22 million self-employed entrepreneurs across the country in all kinds of fields. Here in Iowa, there's 209,000 self-employed entrepreneurs. And then the next layer up is the really small of the so-called small employers. And there's 4.8 million out of the 5.9 million, some 80% have less than 10 employees. And in this category of 1 employee to 100 people that have employees, there's 63,000 small employers. So one thing that, as we look at the health insurance exchange, which will be open to individuals, self-employed, and small employers under 100 employees, we need to realize that they're really small. They don't have what bigger employers have, an HR department, a vice president of this, a vice president of that. They have one person who's maybe they call themselves the president or just the boss, but they're also the HR manager, the CFO, the sales manager, and they're trying to do it all. So as we try to think of how do we build an exchange that works for small business, we want to keep those things in mind. And there's some basic things that I think small business owners are expecting to get out of the exchange. And number one is affordable health care for themselves and their families and their employees. And so we have a lot of self-employed and small employers who are in both sides of the equation. They're not covered or they have coverage, but they're both still looking for affordable because a lot of them are just hanging on, and we've seen in the last decade a real shrinkage. 28% of the self-employed don't have coverage today. That's a national average, and over half of the employers with under 10 don't. So all of these people are going to be looking at the exchange, and it has to be affordable for all of them. The other thing is stable premiums. If you're really small, all of the rating rules and the change in your employee population can cause your premiums to gyrate from year to year. And anybody who's run a real small business has had a lot of rate shock over the years. I think employers would like to have some real choices and competition. It's very typical to contact your broker and you got slammed with a big increase and you try to shop around and maybe you get one or two, and you can tell some of the bids are way higher than others. You know, there's no real competition when you see those kind of bids. So people would like to see more competition and more choices. They're also looking for minimal administrative burden because they're really small. If you're big enough to have an HR department, it's not quite so bad. And if you're really big, then you can become self-insured. And that's a great thing if you're big enough, but usually, you'd have to have at least 250 employees or something to be in that category. But right now, small employers rely on brokers to get their information, is typical, and they just have one plan choice, and they pay to one source. So it's pretty simple out of necessity. So some of the factors as we look at the exchange, how will we get there? How will we provide, with an effective exchange, affordable coverage options for individuals and small employers? We need to maintain low administrative costs. The Massachusetts connector now, which is up to 400,000 lives covered now, their administrative cost has come down to 3%. So maybe there's an experience we can look at as a target as to what's achievable, because that administrative cost in 2015 will have to be passed on. The federal government's going to give funds to help states set up their exchange, but eventually they got to be self-sustaining. So that'll be part of the cost of insurance for people accessing the exchange. We need to attract to the exchange insurers, or else there won't be any choices and there won't be any competition for the people trying to access it. There's a provision that requires the federal government through the Office of Personnel Management to provide at least 2 multi-state plans. One of those has to be a nonprofit. They could supply more than 2. So that is hoped to bring more competition, especially for really small states. We've got 10 states that are basically 1 million population or under, only 1/3 of the size of Iowa population-wise. And we have some experience from other exchanges where they've created incentives for participants to select the lower cost plans. And I've listed some of those here, so that's an experience we can look at to provide affordable choice. Again, from year to year, bigger companies now have they may have health inflation, but they don't have 30-40% increases, and that's why a lot of them are self-insured, to escape that kind of volatility. So a successful exchange would help bring that down. And a lot of the insurance reforms that are in the law itself would go towards this. And of course, to achieve stability, we'll have to avoid adverse selection. Size will matter in a lot of ways. 1, administrative cost. 2, the insurers themselves are going to be attracted if there's a large population. The federal government is insuring 8 million people through the Federal Employees Health Benefit Plans. A lot of people want to be in that market to access those 8 million customers. So that's the whole theory of an exchange. So one study that's done in Wisconsin with Dane County, and a lot of economists have looked at this, and they've theorized that if 20% of the market were inside the exchange, that may be some threshold that causes a higher level of competition that keeps healthcare costs overall down. And that's from the study there in Wisconsin. And lastly, again, for that sake of simplicity of small businesses, they need to have easy to understand choices for the employer, because they could stick with their grandfathered plan, or they can buy insurance outside the exchange, or they can buy inside the exchange. So how are they going to make that decision? And so they're going to need to evaluate all their choices and the costs and the values. I think there needs to be a lot of outreach here as the decisions are made about how each state would set up its exchange, And during the 2013, the year leading up to the operation of the exchange in the first year, be important to get a lot of information out to these over 200,000 self-employed folks in Iowa and the 60,000 employers and all their employees, because there's going to be quite different if they go into the exchange. There's also another decision will have to be made is, will brokers still be utilized? Massachusetts, with their connector, they still is a role for brokers. And brokers do provide other products and services to employers besides just health insurance. So some folks say, well, cut out the brokers, that'll save a lot of money, reduce the cost of insurance, but I think it's a little more complicated than that. One thing I think is essential for employers is that the exchange or somebody figure out a way that they can do what they do now, which is pay one bill, because their employees can pick different plans in the exchange. That will be one of the benefits of having an exchange. But that creates a complexity because now money needs to be routed to multiple insurance companies. Who's going to do that? And I think it's just essential that that gets done administratively on behalf of the small business so they can do what they do now. They have a consolidated bill. They write a check every month for their insurance. They would still do like they do now, collect the employee's share. There's a lot of other things, and I think these issues aren't necessarily in the minds of small business owners that they're thinking about day to day. They're thinking about running their business, and they're thinking about how much does health insurance cost. They're thinking about how do I compete, how do I recruit and retain qualified employees. Even if you've only got 8 employees, you're still thinking that because you're in a competitive world. But these are other choices that will have to be made by each state as they set up their exchange and will ultimately affect how the exchange works and therefore are important to small businesses. So adverse selection, that's why most insurance pools have failed. That's why it really has to be number one. Is there going to be 1 or 2 pools? The law allows states to decide whether they want to have a pool for individuals and a pool for small employers, the so-called SHOP Act. Then in 2017, states would have the option to expand beyond 100 employees. Is that a good idea or not? What are the issues with that? Some people brought up that there could be an adverse selection problem because now you're getting into a category where they're self-insured, and are they staying in or out? Who's going to provide governance, and how will all the stakeholders, whether individuals, self-employed or small employers, how will they have input into the operations of the exchange? And then, as has been pointed out, wellness programs. I think this has been something that large employers have done a great job on and have led the way. But nearly half of the people in our country that are employed work at smaller companies. So if we as a country want to be healthy and we as a country want to be competitive in the global market, we need every American in a wellness program. There is a provision in the law that provides grants for pilot programs, essentially for wellness programs for small business. But I don't think anybody's really figured this out. I think this is a good challenge for Iowa. I've heard it said here today that this is a can-do state. And I've heard a lot of great ideas and a lot of great speakers running your programs here. But somebody in this country needs to figure out how wellness programs that have been run very well in large companies, what is the model that would work at small employers? Is there a role for the exchange to help promote these wellness programs? You're going to have potentially several 100,000, maybe as many as 500,000 people in your exchange here if it works well. How do they participate in a wellness program? That would be a good thing. So my last slide here, and this is really just some stuff that's on our website. So, and this is aimed for small business owners, and we just really try to look at the questions that they're asking us and come up with the answers. We have a calculator so they can go on and figure out if they're small business tax credit. And there's one little success story I want to mention. Blue Cross Blue Shield in Kansas City decided that this 35% tax credit for small employers was a good idea. They went out and marketed it to several hundred new employers that didn't provide insurance, and there are now 5,000 employees in Kansas City who didn't have insurance because one company went out and marketed a tax credit to new customers. So things can change. Thank you very much.